Well, I think that most of the hospitals in the region have been operating at capacity or near capacity for the last week or so.
That is Dr. Robert Scoggins from Kootenai Health in Coeur d'Alene, and he's talking about surging COVID numbers they are seeing in North Idaho right now. I spoke with him earlier this afternoon, and today he told me he is concerned, he's frustrated, and he's tired because we have vaccines that are safe and effective. Yet here we are 16 months into the pandemic, and we are once again at a situation where hospitals are at or near capacity. Dr. Scoggins says they are seeing a surge in patients similar to the surges we saw last winter and back in July. The patients this time, he said, tend to be what he described as younger than in previous surges. He also said it's not just COVID patients being impacted, but things like elective surgeries or even more surgeries are being impacted by the availability of beds. So if they're out of a bed, a procedure could be delayed. Okay, so what's behind the latest surge? I asked the doctor that today.
What do you attribute it to? Is it people who are deciding not to get vaccinated?
It is the vast majority of patients that are being admitted are unvaccinated. It is also the Delta variant is the predominant variant in the community right now. And this is a very highly transmissible variant, different than what we've seen previously.
Gotcha.
So more people are getting infected, younger people are getting infected.
I also asked Dr. Scoggins if he's treated patients who wound up in the ICU with COVID who are not vaccinated, if they changed their tune on getting the vaccine after getting so sick. He told me, yes, several of them have. And he also reiterated the vaccines are safe and really effective. He urges everyone to please get vaccinated for their sake and for the sake of anybody else who might need to be treated in the hospital.
And Governor Brad Little today stressed how important it is for everyone in the state of Idaho to get vaccinated against COVID-19. He says those in the state need to protect students going back to school in person in the fall, especially against the Delta variant.
With more and more Idahoans getting vaccinated since the start of the year, we have seen a steady decline in cases throughout spring and summer. But now COVID variants are spreading, and we're seeing more COVID cases and hospitalizations across the country and here in Idaho.
The governor asked those who are concerned about the vaccine and its possible side effects to have a conversation with their doctor and get information from healthcare professionals in regards to the benefits of being vaccinated.
It's not just Idaho either. In Washington, there's been a sharp increase in COVID cases due to the Delta variant, which is making up 76% of the cases across the state now. Over the past 4 days, an average of 1,500 new cases have been reported each day. Hospital occupancy is at the highest level seen to date in 2021 due to increased COVID-19 transmission, patient demand, and hospital staffing challenges. Today, there will be 6,000 new cases added to the state's dashboard because of a backlog since July 30th. 451 new cases were reported in Spokane County since July 30th to make up some of that backlog. The state's positivity rate is also climbing rapidly to 5.5%, up from a low of 2% a month ago. And more than 600 people are hospitalized with COVID-19, an increase of more than 20% from just last week. Meantime, Kaiser Permanente and Multicare will require all of their employees to get a COVID vaccine. Many other hospitals in the inland Northwest have already implemented similar policies. Primary Health, St. Alphonsus Health System, and St. Luke's Health System all announced their employees have been given a deadline to either get vaccinated against the infectious respiratory illness or face termination. Providence currently does not require caregivers to receive the COVID-19 vaccine.